everybody. Welcome to Anatomical Gangster. I'm your host, Sue Hitzmann. If you know me from the world of fascia, you'll be thrilled to listen in on this conversation with one of the coolest female pioneers in defining the human fascial system, Dr. Carla Stecco. Carla has dedicated her entire life to science and research, and her work has uncovered scientific evidence to deepen our understanding of how fascia adapts as we age and what we can do to combat the unwanted adaptations. Now, in this conversation, we talk about hormones, being female, the differences women come up against as we age, how fascia and hormonal imbalances are linked, and so much more. Now listen, if you enjoy this conversation, please share it with your friends, subscribe to the channel, leave a comment, and if you think of somebody I should interview, make sure to leave that message for me as well. I'm always looking for brilliant minds to teach me something I don't know about, but I'm super curious to learn. I hope you enjoy this conversation. Here is Dr. Carla Stecco. So welcome everybody to another anatomical conversation. Today we're talking to Carla Stecco. I've given you the introduction of this amazing woman. Carla, thank you so much for just coming and hanging out and sharing some of your wisdom, because for me, you know, I of course have a number of your books, your functional atlas in my repertoire, and has always been a great reference since I've had it. And watching you over, really now it's shocking to me that it's, for me, 20 years since I was introduced to your work. I don't know how 20 years have passed by, yet I've seen you, right? But I've seen you, you know, just grow and grow. And one of the big things that you've done is really help to move ahead some of the research on fascia. And of course, in 2019, when we had the Berlin conference, and you shared your work that you've discovered a new cell in fascia that you've defined as a fasciacyte, and sort of giving a new perspective on how our fibroblasts and myofibroblasts and fasciacytes are producing what is the collagen matrix and the hyaluronin, and what kind of the gel-like substance that keeps us together. And my come from when I talk about it is I'm frequently saying, I mean, imagine that in 2019, we're discovering new cells in a substance that it's been widely studied and it's always been known, but it's really in these past 2 to 3 decades where real research has started to kind of engulf the process of really seeing fascia not just as a tissue, but as a sensory organ, and as well perhaps a system. And maybe it's the only substance in the entire body that could be classified as all three, which I find fantastic. So I'm curious, like, if you could, I'm sure that everybody who's probably listening to this, because most people who listen to these podcasts are sort of in our community, but can you share a little bit about, I'm curious, I don't know how many people have asked you this, but you know, you grow up in a family where you've got your father, Antonio, you know, and all of his work. What was it like growing up in such a scientific family? And how was that? Was there a lot of pressure when you were younger to become a scientist? Or has this been something that you've always been interested in?
No, there was not really a pressure, but surely all the discussion in the family were all focused into the fascia. For my father, there is no other possibility to discuss about the fascia. So we can start to speak about the weather, about the holiday, and you can be sure that in few minutes we move to speak about the fascia. Every time, every time. For my husband, is very strange because he say that our family lunch, family dinner are pretty crazy for that.
Yeah, I'm sure. I'm sure. I mean, it must be that, you know, what'd you learn new in school today? Well, forget that. Let me talk about this connective tissue. So fascia for you, the definition, you know, one of the things in the community that I'm always very perplexed with is language, is definition, and science loves to define things. And I think that's why maybe fascia has been a little slow on the uptake of research, because there's so many ways to define it. So I'd be curious, what's your definition of fascia? And into that, perhaps what is unique about your definition compared to a traditional school of thought?
Yeah, I have not my definition of a fascia. Are 15 years that I'm involved in the discussion about the definition of a fascia. Also, now we are discussing, and is 1 year that we are creating a new group to discuss about a further definition of fascia. And I'm sure that is still a work in progress, because more we understand the fascia, more we need to upgrade the definition. I think that we are just at the beginning of the understanding of fascia, and consequently also the definition need to be modified, changed according with the new discovering. The problem of the definition is really that we know only some element of the fascia, and the fascia is a tissue that could be precise, but at the same time is a network that connect many different elements. In some part has some characteristics, in other areas totally different characteristics. So it's difficult to find an element that put together all this network and at the same time allow you to be precise. Because, for example, as a researcher, I need to be precise. I need to write in a paper exactly what piece of fascia I sample, I study. I can't just say, oh, I study the fascia. The people need to know is from the leg, is an aponeurotic fascia, a superficial fascia, an epimysial fascia, is a visceral fascia. So we need to be precise because the different characteristics, the innervation, the biomechanical properties, the elastic fiber amount are very different in the different fascia. So we need to be precise. At the same time, we need to underline the role of connection. So now my suggestion and my way to see the fascia is to have a system, so a big family, a big umbrella that and with a clear definition that underline the element of force transmission, of gliding, of network, and then under that umbrella many different organs. And for me, for example, the musculoskeletal fascia is like an organ, the superficial fascia is another organ, the visceral fascia is another organ. And inside the different organ, we have many different parts that can be still precise to highlight exactly what is the small portion that we are looking. So we can move from a macro to micro in many different way without lost the concept of continuity, but at the same time trying to be more precise as possible.
Yeah, that's really a great way to say it. And I think it really makes me think, I'm so fascinated with nature and its unpredictability. And I talked to JC Gumberto, and he was like, yeah, I mean, when you look at even the bookshelf behind you, right? That's a non-living structure, and it has like these very organized lines. But then you see the plants, and this not so straight line object, right? And so it's very important also when people hear that, and something hopefully you guys are hearing what Carla's saying is that depending upon where you are in the body, fascia presents itself differently, right? In our superficial fascia, it's more areolar and a little fluffy, and when you've got fat in there. But then these other membranous layers, you won't find the presence of fat, or some regions of the body fascia seems very linear and it's very predictable, but then in other areas it isn't. But again, if I can cut it with a blade, I'm in the macro level. But then again, if I look at it under a microscope, now you have this microcosm, which is even more chaotic and unpredictable. And I think that's where, some of this pioneering work that you've had to say, hey, there's another cell that's producing hyaluronan. And that right there is I think, a huge discovery, because I would wonder, in certain regions, will we find more of those cells, and in other areas not finding the cells at all, not finding the deposition of these cells, right? I mean, like, that's going to change the definition itself, right?
But indeed, when I discovered the fasciacytes, I was enthusiastic. But honestly, until now, nobody take care too much about the fasciacytes. And it's a pity because I think that, for example, to be able to stimulate in the proper way the fasciacytes with exercise or with a drug or with a specific mechanical or physical input can really improve the gliding of the fascia, permit a better mobility of the muscle of the joint. So I think that could be really a nice target for the treatment.
I think so
But
too.
we'll see in the future.
Yeah, I think so too. I mean, I think all of these discoveries are so critical. And I know that, in even for me, in the 90s, the idea of myofascia was what I was introduced to. And so you have this very myopic, very simplified view of muscles in relationship with fascia, and then come to discover, oh, all of these other things that are outside of the myofascial layers are in fact extremely important to the functionality of our form, as well as the processes of aging. And one of the most important things, I think, is hormone regulation and hormone balance. And I know that, we're women, and so we tend to be more concerned about female health. I think that there's a entire world out there who has completely disregarded female health. And I think that the fascial research, I think, and I think your work is starting to be more directed toward this, is what role does fascia play, or what is the communication and the connection between hormone regulation and the fascial tissues in relationship to aging, especially for women? Do you have sort of insight on things that perhaps most people don't know about with hormone regulation and fascia?
We I started to look about hormone because in the clinical practice is evident that the myofascial pain has a different frequency and a different aspect in female and in male. And also some the menstruation, the ovulation can trigger some myofascial pain in the female. So I was curious to see why. And the first step was to look if the fascia express the receptor for the estrogen, relaxin, and progesterone. And we found all the different receptor. We also demonstrate as after menopause the receptor decrease, so the fascia became less sensitive to the hormonal input.
Mm.
Then the second step was to understand what happen under estrogen stimulation. So we take a sample of a fascia, then we isolate the cell and we stimulate the cell in the lab with a different level of estrogen to simulate the postmenopausal input, the ovulation, the pregnancy, and we demonstrate as the estrogen are really able to activate the cell. The cell start to release in the extracellular matrix, above all, collagen type 3 and elastic fiber. It means, and that is strange because usually in the fascia we have more collagen type 1, but during pregnancy, we need to have fascia that are more elastic because we need to change the volume of our abdomen. We need to have an adaptation. And consequently, the estrogen work not only in the placenta, in the fetus, what we want, but also in our fascia to allow the pregnancy. And that is surely important, but at the same time means that our fascia lost stability because we change from collagen type 1 to collagen type 3. So the fascia that may be in the back, in the pelvis, can help to give some stability. During pregnancy, we lost that part of stability, and maybe that can trigger pelvic pain, back pain, or other type of pain. So I think that is really important how the fascia answer to the hormone, because if we have a few estrogen receptor in our fascia, maybe our fascia is not able to adapt, and consequently we have less space. We maintain like a tension around our uterus.
Mm.
But if we answer too much, maybe we can become too loose, and so is surely is a line of research that I'd like to study much more because can really explain some extreme reaction to the pregnancy that we can find in our patient.
Mm. Yeah, I mean that's pretty powerful. And like so, for somebody like me, I'm in my 50s, I'm through menopause now, but I did not have children, right? And so I think to myself, when people talk about all of the issues that they have as they go through menopause, the hot flashes, all of these, sleep problems, pain, it's significantly higher in women. And certainly hormones play a role in this process. But I wonder, it seems to me that it's almost like a swinging door, that estrogen can alter fascia. It can actually alter the collagen, but that the hyaluronin in the fluid flow of fascia is very supportive to estrogen, to the mobility of it, to the transportation of it, progesterone, testosterone, right? It seems that there's a regulation where if the receptors kind of die out after a while. It seems to me that as we get older, we actually have less reception, less receptors to be able to latch onto it, which is why we have all of these issues, right?
Exactly, exactly. And another very important topic for me related to that are the antiestrogenic treatment for breast cancer, because typically many female can tolerate the antiestrogenic treatment without problem. But a minority has a lot of myofascial pain, a lot of pain, and is considered a problem of this antiestrogenic treatment. I had some patient that I was able to check the fascia and they are very rigid. I did the treatment, they feel better, but after few weeks they come back because the anti-estrogenic treatment for me change and create really an alteration in the fascia and in female that are particularly sensitive to that, probably the alteration create too much myofascial pain. So with manual treatment, I was able to help a little bit, but then the anti-estrogenic treatment maintain and recreate always the problem. So in this female, for example, I did constant treatment for 5 years
Huh.
and just to help them to tolerate better the anti-estrogenic treatment. After the end of the treatment, all the myofascial pain disappeared.
Interesting, interesting. So tell me more, like what does estrogenic treatment entail? What is it? Is it a drug? Is it a process? What is it?
Is a drug that the for breast
Ingestible or
cancer.
cream or
No, no, you can take per house or you can use also the patch, but are therapy that are given after removing the surgery of a breast cancer
Mhm,
because we know that decreasing the level of estrogen can protect from the recovery of the disease. So surely is an important treatment, and many female are able to tolerate pretty well this type of treatment. But in 10-20% of the female, they have as a bad outcome huge pain.
mhm.
And for me, that is related to the fascia again.
Yeah.
So I hope in the future to find somebody that could be interested in such type of study, because maybe we can create or a different drug that can't affect the fascia so widely, or maybe we can found another drug that associate can support the fascia, for example, supporting the hyaluron and supporting the gliding, and in such a way the female can tolerate better the anti-estrogenic treatment.
Yeah, I love that. I mean, I just think that, I see so many people over the many years of practice, and I find more women than men suffer with myofascial pain syndromes, or what I would define as a myofascial pain syndrome. And I think that one of the significant differences between men and women is estrogen, is the
No, but
production, right? So, one of the things that I thought was very fascinating when I was able to look at fascia under high powered microscopes is that you really see that as you age, the crimp of fascia seems to be less crimpy. The elastic property of it seems to decline. And so there's things that I've heard researchers say is like, oh, well, not only are you creating less collagen as you age, you're producing less quality as fascial tissues, right? The collagen is actually less resilient. It doesn't have the elastic properties that it does. And so I'm wondering, are you seeing this also? Do you agree with those kind of concepts? And then there's so many products now out on the market. It's hard to figure out what is, right to take, what kind of is like not so much. I mean, I know for myself, taking collagen, my hair, skin, and nails for sure, but can it absorb into my fascial tissues? Can it help to support the collagen throughout my entire body? There's now you can take hyaluronin pills. There's all sorts of things that are there. How do you feel about, instead of just medication, supplementation for the benefit of the collagen synthesis in the fascial system?
so surely we published two, three paper about fascia and aging, and surely the fascia is affected by aging. No way we have less adaptable fascia. We demonstrate with the bioengineering department. We take just a muscle fiber of a young man and an old man. Then, and we stretch and we analyze the resistance. And between just the fiber between the young and the old, there was no difference at all from a mechanical point of view. Then we take a muscle bundle, so the fiber, but also with the connective tissue around. And the mechanical properties between the young and the old change totally.
Mm.
So to demonstrate really that the rigidity that we feel in the muscle becoming older are not related to the muscle, but are related to the fascia around the muscle. That is clear. Then we did the study with the histology. So we check the amount of collagen fiber in the intramuscular connective tissue. And with aging, we have much more collagen fiber. So I don't think that we need more collagen in our fascia. The problem is that we have too much collagen in our fascia because seems that we born with fascia with a lot of hyaluronan and a few collagen fiber and also disarranged. Then with the movement, our fascia organize itself. So we organize the disposition of the collagen fiber, the line of tension, the force transmission, and we create a very performating fascia. And that is the best around 20, 30 years old. But then the deposition of collagen fiber is in continuous, and that create probably more stability because we create like an exoskeleton that can support our body, our posture, our usual position. But we lost the range of motion, we lost ability to move.
Mm.
And I think that really with exercise, we need to contrast a little bit that evolution because we need to remember that we were selected in the evolution to live until 40, 50, not too long. So also our fascia, I think that they are perfect to resist a limited time. Then we have that rigidity, that fibrosis that became too much. So we also demonstrate that with aging we lost hyaluronan. Is a constantly decrease of hyaluronan when we born. We have such amount of hyaluronan, then we have a very vertical and rapid decrease of hyaluronan until 20, 30, we need to understand.
It's
Then the
terrible.
decrease is slowly, but still is decreasing.
So with hyaluronan, I mean, it seems to me that you cannot, it just doesn't seem possible to me that you could ingest hyaluronan and it would transport and somehow benefit the fascial tissue. It seems to me not,
Indeed,
not
is
possible.
that the problem? After the study, I started to eat hyaluronan in the morning, at the lunch, every time to increase the amount of hyaluronan in my body, but no effect from a clinical point of view. And I also spoke with a famous nutritionist, and he told me that is the most expensive way to eat sugar because the hyaluronan is destroyed in our intestine.
Yeah.
And consequently, there is no way to introduce hyaluronan.
Except
Just
for maybe injections. I mean, I do recall, I cannot think of their name, but that one of the researchers, female researcher at one of the fascia congresses, was discussing how um, people who have like Dupuytren's, and that they would inject hyaluronan into the tissue, and suddenly they were really able to move. So it seems to me there is a potential with hyaluronan to inject it in particular circumstances direct towards tendons, right? Where maybe might make some change in a tendinous mobility, right?
yes, now is pretty popular to inject hyaluronan around the tendon, and we know that is very effective. In November, I will start a new course in at the Padova University to explain how to inject fascia, because now we have a pretty good expertise how to visualize fascia with the ultrasound, how is the organization of the fascia. And I think that will be a new treatment. We need to understand much more all the potentiality, what we can inject, and so on. But I think that the injection of fascia will increase a lot in the next future.
Yeah, I think so too, for sure. And what about, there's all this new research, right? Everybody's a biohacker. Apparently, people are biohacking their bodies. There's all, again, all these new stem cell research. Now they're injecting people with PRP therapy with stem cells, right? I would wonder, and even things like microbiomes, right? Like there are people who are linking the health of the microbiome to the volume and fluid perfusion through the fascial matrix into the lymphatic system. That there's a relationship. Do you, in your research, do you see a relationship between stem cells, fascial cells, and then microbiome? Do you see a link between them?
That is too much. But surely, not surely, one of the hypotheses that I'm following is a relationship between the superficial fascia and the microbiome of the intestine. But that is only from a clinical experience. In the clinical experience, I have the impression that the people with food intolerance, irritable bowel syndrome, alteration in the intestine have often the superficial fascia that is very altered. So that relationship is very interesting. We can explain with the connection of the autonomic nervous system. In the superficial fascia, we have a huge amount of autonomic nerve. We can also explain with the chronic inflammation because the alteration in the intestine can create a chronic inflammation, and we know that this chronic inflammation can go in the brain, in the heart, in the artery, and I think that can go also into the fascia, above all in the superficial fascia that is rich in vessel, lymphatic vessel,
Mhm.
so can trigger an alteration in the superficial fascia. About the stem cell, sometime I have the impression that the fascia could be also a reservoir of stem cell, but we need to study much more about that.
Yeah, yeah, I'm certain. I mean, like, there's just so, I think that what I've learned about science is that it's a very exquisitely slow process with research. It takes an incredible amount of money. It takes an incredible team and time to be able to bring something out that's really going to kind of push the boundaries of where we are to try to get something new. And I think that there's frequently you kind of get a lot of pushback. I've been happy to, Tom Findlay, who kind of took me under his wing long ago when I was like, it's fluid flow in fascia. Like you can actually change this and adapt it, and you can do it in a subtle body way. And going and trying to create a research study on it, and then realizing that there's so many variables that you have to exclude, right? If somebody had, we were doing it for low back pain. So if they had already had cortisone injections, or they had a Harrington rod, or they were pregnant, or they had a high BMI, they were excluded from the research study. And I think to myself, well, most people who have low back pain are overweight. So it quite a struggle that you go through. And especially for women's health, I feel like we are sorely behind in research for women's health, trying to aid in the benefit of that longevity. Because, like you said just a few minutes ago, long ago, people were living, their health span was short, their lifespan short, right? You're talking about 40s, 50s, people were dying. And now you're looking at this generation over the last century, and people are living longer, but there's nothing saying that we're going to live better longer. And so some of those bell curves of trying to prolong health has actually diminished, and all you're doing is just adding bad years to the time. So I wonder, with the research that you're doing, do you feel that there's an opportunity here to try to get the younger generation more involved in understanding longevity and having fascia as a leading point of research for the longevity of humankind, to allow us to live into the centennial years, 100, 110, right? Because I'm sure you and I will be chatting with each other when we're like 114 years old. I'm sure it's going to happen. But I wonder, how do we get more, how do we get the younger generation more involved in research, especially the women? I feel like we're lacking females in research, and I think that the only way to get female research moving forward, I think, is for females to take more of a curiosity of this, but to get it into the hands of the younger generation to prolong the health span. Don't you think that there's something there?
Allora, about the longevity, I more and more convinced that the fascia can play really a key role, because in the past I look and I study the fascia only for pain. And also in my patient, often I told them, I treat you only if you have a pain. I'm not interested to take care of you if you have no problem. But now I'm understanding that there is not only the pain, there is like a well-being, like to become older in the best way as possible. And all that change my view of fascia, because not only for the locomotor system, because the locomotor system, surely, if I have a better posture, if I can move without pain, with a full range of motion, is better. But also for the visceral fascia, if I can have a better digestion, if I can have a stomach that can full and empty without problem, if my urinary bladder can dilatate and empty totally, I have less infection, I have no urinary incontinence, I have a better condition of the life. And we published a paper about the possible role of fascia in hypertension, because the fascia has an incredible network of vessels. That vessels are regulated by the sympathetic innervation. And in the fascial vessel, there are also the receptor for the angiotensin, that is one of the key hormone that regulate the blood pressure.
Mhm.
So it's possible that a good fascia can maybe manage better the blood pressure also. So we have so many implications in the fascia that really they be able to manage as better as we can the fascia in a more general way, not just for pain, could be very useful to have a better life and a better aging,
Yeah.
maybe reducing also the amount of drug.
Gosh, I hope so. I think you're really hitting a huge point. And again, I think as being somebody, I always say I'm a neurofascial science and research educator. I spend copious amount of hours reading research papers and then trying to simplify this information to the layman to get them to take action, to realize that there is a system in the body that most people don't know anything about, that is not only playing a role in pain mitigation, but also the creation of pain, longevity. And even one of Robert Schleip's recent pursuits was looking at depression and fascia. And, there's kind of, again, this two-way street of saying, well, in depressed patients, we tend to find that the tissue is almost, there's a dampening effect to it, but it also has more stiffness, right? So it's kind of it's like an anomaly in the body. And I said to him, well, it seems to me that when you're depressed, you sort of feel underwater, like a soppy, dirty sponge. It's lost its ability to move the fluid through the nooks and crannies. And so that is now creating less feeling, almost less frequency, less vibration through the fluid matrix. And I think that is one of these things that can then kind of fatigue us. We have less circulation, we have less blood flow. But I think that there is a correlation between the adaptations in our mind. Then, if we don't feel good, we're not moving, fascia is going to become less mobile. It loses its stability. But I think it could also go the other way if we are just not moving because we have to sit at our desk all day long. Over time, this will cause the fascial tissue to change. And then when we don't feel good, our mind changes. So there is a piece of this of, I think, longevity and resilience that people should hear, that we can make ourselves feel better through engaging in self-care, through understanding how much, eating a nutritious diet, drinking water more frequently, moving, stretching, breathing, and just engaging in touch is so critical to the betterment of us over our lifetime. And one of the tissues that changes with all of these factors is fascia, right? I mean, it relates to all of it, right?
Exactly. And is really important, but think about how many receptor has the fascia, and the majority of the input are unconscious. So if I have a fascia that is in a bad condition, we have a thousand of input that in an unconscious way tell to your brain that the body is not good, that you don't feel well, that there is something that is not working. So that can really maintain the input of depression or of a not well stain. I have many patients now that tell me that they come just to feel better, not only with the body, but also with the mind, or maybe that they are able to tolerate better the stress of the life. Because if your body is in a better condition, you are stronger in front of all the stressful situation of the life.
Yeah, for sure. And one of the other things that I think has been really intriguing with the Fascial Research Society, people like Dr. Peter Friedel talking about cancer metastasis and this peculiarity, and some speculation that cancer cells love to live in stiff fascia, that if they are not moving, if they somehow get stuck in this tissue, that is one of the catalysts for cancer metastasis. So it seems to me that it is of the utmost importance to move, to breathe, to touch your body, to not be so entrapped in a physical form, because I think some people have a hard time being in skin, right? We have a hard time being trapped in a body.
Yeah, yeah. But we have just published a paper about the presence of the protein, the YAP receptor, that is a mechanoreceptor that we know is related to metastatization, and we found it in the fascia. So surely the fascia has the ability to have a mechanotransduction,
Mhm.
and we just need to understand what are the best input to maintain an healthy condition.
That's so well said. I mean, it's just, I always say you're not going to take this form with you when you leave this earth, right? But treat it like your gift of a transportation system that does so much for us. We should be so lucky to be able to be in a form that works well for a lifetime. And so active participation in trying to maintain the functionality of our body, I think it's important
Of
that we,
course,
right? It's
it's
just
a fundamental. Also, because really, I have a lot of patients that think that prosthesis is the solution. But it's not the solution. We need to think much earlier to our joint, to our body, and try to maintain an healthy condition as long as
right.
possible.
That's right. And I mean, scars, I think that really, one of the things that really hit me the first time that I did a dissection with Gil Headley, I had done dissections in school before, never saw the human body the way I did with him. And when we had this form that had a tiny little scar, a couple tiny little scars, and so we speculated at the beginning of the dissection, oh, that's a gallbladder surgery. And as we went layer by layer, that little tiny scar in the superficial fascia was more like a bullseye, and then trying to peel the superficial fascia away from the deeper fascial tissues was like, made sounds. And then when we went into the visceral fascia, it just looked like somebody took chewing gum, put it in somebody's hair, and then stuck it into the form. It was just all over the place. This web had hooked around the large intestine. It was just like a maze in there. And I think to myself, I think that anyone hearing this, I hope that, and I'm sure you're going to agree with this, that don't forget that scar tissue will continue to uh, span in its place if you don't touch, move, mobilize. You actually have the potential to boost the glide ability once a scar has healed. That we should be touching a scar, we should be pulling on the tissue to decrease some of the negative effects of something that saved us from death in some instances.
It's fundamental, and it's also important to remember that we need to remember that the skin often is better respect to what there is under the skin, because many people think that a nice scar
Right.
means a good
Perfect.
healing process. But it is not true. I saw many, many patients and cadavers that in the skin the scar is good, but when you touch the deep fascia, the muscular fascia, the different layer, is a disaster. And again, that is related to two different problems. The surgeon that don't take care of fascia in the proper way, and the patient, the rehabilitation doctor that think that when the scar in the surface is okay, and we do a lot of treatment just for the surface, the scar is okay. but is totally wrong because if we create adhesion as you have described, the function of the muscle is totally altered, the function of the viscera are totally altered. So the problem in the skin is the less important part of the scar.
Yeah, I mean, it seems to me that there's a lot of surgeons who still are quite ignorant on any of the fascial research. They don't really know very much about it. In fact, they're like, I don't even know why we're talking about it, right? And I just think to myself, I would like for you to know about it, though. Please think about this before you make another incision in a form. It would be, I think, it would behoove a surgeon to learn more about this cutting edge research, because then they can share that message to their clients, even though they may or may not change their surgical procedure. Perhaps they might mention to somebody that, hey, after this, you might want to go see somebody who does tissue work to be able to mobilize that, work on the scar. Don't just let it heal and try to forget about it.
Yeah, but one of my dream is really that also the surgeon will take care in a different way of a fascia, because if they suture in the proper way the fascia, surely is better. But also if they cut according with the logic of a fascia will be better. For example, go using the plan of dissection without cut just crossing. Try to found the place where you can destroy less connection, less crossing of the fiber that maybe could be more difficult to recreate after surgery. So I think that in the future we can really improve also the way to do surgery, and but we need to know and we need to study more.
That's indeed. I mean, that's the one thing that, when I hear about a fascia guru and these fasciologists that are out there touting that they are the gurus of fashion, I think to myself, we're really just at the beginning of really taking a closer look. And I think the problem that I see with a lot of people who are suddenly these experts in fascia is that they jump too quickly from hearing about microscopic study and turning it into a macroscopic concept. And so I think that we have a long way to go in educating people into the microcosm of fascia, to teach them on the cellular level, to then bring this deeper understanding of biology and our very biology into the mix of anatomy and biomechanics, et cetera. But I think there's a big uh, valley there that we still have to leap over before we're really going to get, I think, a full understanding. I think we might be many years away, but certainly your work has pioneered so much, as well as some of the other people in the Research Congress. I mean, it's incredible to see what's happened in 20 years, but knowing that in 20 years from now, it's hopefully we will amplify this much more.
I hope so, and I think that is really important what you are doing, and it's important to speak about fascia at all the different level, because only if all the people know the fascia, are awake about the possible role of fascia, we can really push the research in that direction. We can change the medicine, because now, for example, one of the big problem is that there are almost no grant for fascia, or very few. There is just Professor Langevin with NIH that create the first grant to study fascia,
Amazing.
but still in Europe, nobody take care of fascia as a grant. And consequently, is also a problem to find the money to do research.
Yeah, it's really, and it is. It just takes so much money and time, and I think you're right. Like it's how do you get in front of people who create the grants to be able to create a grant for fascial research? I think it's definitely something we've got to work on for sure. So all of my guests that I talked to on this, I asked the same question. So I'm going to ask it to you. Let's see what your answer is. So the question is, if you could tell somebody something that you don't think most people know anything about, but if they did, it perhaps could change the very course of their lives. What is it?
It's a difficult
I
question.
know.
No, I really suggest to take care of their fascia as better as they can. Do eat well, have a good exercise, manual treatment, and try to maintain the health as better as we can because it's really a gift.
Indeed. Well, and I mean, I hope everybody's hearing this. So we've tied fascia to the nervous system, the lymphatic system, cancer, aging, hormones, neurotransmitters, and your overall sense of resilience and well being. So if we haven't in this hour made you at least a little bit curious, to go out there and learn a little bit more about fascia, but more importantly, Carla's research. I mean, again, one of the bigger pioneers of our industry, many books, and consistently looking for new ways to incorporate new research in this field. And I think it's just amazing how far you've come and what you've done over these past 2 decades. If people want to learn more about your research or get involved with your research, perhaps fund some of your research, how can they find you? How can they find where you are, what you're doing, and how to support you with your work?
I'm a professor at the University of Padova, the Department of Neuroscience. So you can find my email, my address, my phone in the website of the university, and it's pretty easy to reach me. I'm also the founder member of Fascia Manipulation Association and of the Fascia Manipulation Institute. So also in this other side, you can join me. About my research, I have the book. I have more than 200 paper in PubMed. So I try to publish all my research in the last year also with open access to help the spreading of the research. So I hope that all the people can reach and read my research without a problem.
Indeed. And again, there's just literally 100 different research papers. I mean, there's just so much that you could just get lost in your work, to which I have many, many days of myself. I have read many of your papers. And it's just incredible. I mean, really, such a body of work that you've created. And I just know intuitively that where you are now and what you'll discover over this next decade, just simply by way of curiosity and I think pushing community and bringing more people into the work, I think is really, it's going to change. I think we're in the middle of a paradigm. So I just can't wait to see what you've done. I look forward to finally coming to Europe and taking one of your courses. Of course, Antonio, I've taken a couple of his, and he's a wonderful teacher. Always fun to hang out with your brother. I love him very much. Such a great person, and I just think it's exciting to see what you guys are doing. So thank you.
Okay, I wait you in Padova. Maybe the winter school could be very fun.
I think I'm going to have to look it up and see if I can sneak that one in. So thank you. So for those
Thank
of
you.
you guys watching this, if you've enjoyed this conversation with Carla, again, reach out and find her. You'll find all of these great research papers, so much to learn about connective tissue. And if you enjoyed this conversation, make sure that you subscribe to our page. And until another Anatomical Gangster conversation, we'll all see you soon. Thanks again, Carla.
Thank you to everybody. Thank you, Sue.